Hi, my name is Shakura Showell, and I will be discussing prenatal health counseling and schizophrenia. Schizophrenia can be classified as a neuropsychiatric disorder. Individuals with this disorder may struggle with the way they think, behave, and feel. It has been found that prenatal exposure to infections such as influenza can be associated with an increased risk of neuropsychiatric disorders. The research questions if there are strategies to enhance immune function in expecting mothers to prevent schizophrenia. The research hypothesizes that women who receive counseling before conception throughout their prenatal and their postnatal period are least likely to have offspring that develop schizophrenia in comparison to women that do not receive counseling before conception. An experimental design will be used to gather data for this study. The study will be conducted over a course of 20 plus years, making it a longitudinal study. The study seeks to find if counseling, which is viewed as the independent variable, has an effect on the dependent variable, which can be viewed as schizophrenia developing in the offspring. The proposed study will consist of 30 female participants ranging from the ages of 25 to 35. 15 women that are trying to conceive will be selected to receive counseling before conception, during their prenatal phase, and during the postnatal phase. The second group of 15 female participants will have conceived already and will be between 14 to 15 weeks pregnant. Each parent will be asked to complete the positive and negative syndrome scale until the child is of age to complete the questionnaire themselves. The positive and negative syndrome scale is a medical scale that is used for measuring schizophrenic symptoms. There are 30 items on the scale. The participants must select 1 through 7. 1 is the behavior being absent, and 7 is the behavior being extreme. Items include statements such as disorientation, poor impulse control, and depression. Each participant will be required to sign a consent form and will be required to attend counseling sessions monthly as a group. Each participant will be able to stop counseling after the child is 8 weeks old. Parents are required to monitor their child's behavior so that they are able to report their child's progression of behavior accurately. Every 7 to 10 years, each offspring of the participant will be asked to come in to receive an MRI. Each MRI will be conducted at Centera Health Center located in Hampton, Virginia. Non-contrast T1 MRIs will be used to view any changes of the brain or abnormalities. Non-contrast T1 MRIs provide good contrast between gray matter and white matter. This will be beneficial due to a symptom of neurological disorders such as schizophrenia being the damage to white matter in the brain. A study conducted in 2009 suggested that enlarged lateral ventricles in the brain are the most prevalent abnormality in individuals with schizophrenia. The use of non-contrast T1 MRIs will allow a detailed image of the brain. The analysis plan for the proposed study will consist of the analysis of variance model. The results from the 15 women that were actively trying to conceive and the results from the women that had already conceived will be compared. The results from the study will determine if counseling before conception on immune health is a positive preventative strategy when it comes to the offspring developing schizophrenia. Research that was previously conducted suggests that the immune health of the mother can cause schizophrenia in the offspring. It can be concluded that further research should look into early preventative strategies of infection during prenatal care that include mothers that have already exposed the fetus to infection. Thanks for watching my discussion on prenatal health counseling and schizophrenia. Don't forget to subscribe.